welcome. I'm Cheryl Mitchell, the president of Trelevan Inc., which is a retreat and learning center out on a sheep farm in Addison County. And one of the things that we're very interested in doing is supporting families with young kids, and especially supporting the people that help care for families. So I'm thrilled that we're starting a new interview program today. This is our very first session called Growing Bright Futures. It's a joint effort between Trelevan, Building Bright Futures of Addison County, and Let's Grow Kids, which is the statewide public education campaign. And I'm particularly thrilled that our guest today is Jeffrey Heath, who's a public health nurse. Jeffrey, welcome.
Thank you.
Thank you so much for coming.
Yeah.
As we thought about this show, we hoped to do two things, and one is to provide content information for people who are interested in young children, and also to get to know a little bit better the experts in our community that are providing that care and thinking. So I'm wondering if we should launch right into the creepy topic of tics, which is our content information for today.
Yeah.
Why don't we do that, and then we can backtrack a little bit later and talk with you about how you came to be doing this work.
Okay.
So teach us everything about tics. What should people know?
Well, ticks that are definitely in Vermont. Black-legged ticks, or otherwise known as deer ticks, carry the Lyme bacteria. It's Borrelia burgdorferi, not that anybody has to remember that, but that's the name of the bacteria. And it's spread through tick bites. And what we've seen over the last 10 years is that Lyme disease has become more prevalent in Vermont, particularly in the southern counties of Vermont, but now all throughout Vermont.
Have you actually had cases here in Addison County?
Yes,
Oh,
yes,
okay.
many cases. In fact, on a statewide level, in 2005, 2006, there was a small number of cases, most of which were acquired outside of the state. And what we found is that between 2005 and today, that the number of Lyme cases that were acquired in Vermont have grown exponentially from 2006, about 100 cases, up to 500 and 600 cases across the state of Vermont.
Mm-hmm.
And I get reports weekly of new Lyme cases that get reported from physicians and the hospital and from the labs.
So are you the clearinghouse, the health department, for all reports of
It
Lyme
is
disease? Is it like an epidemic? What?
It is a reportable illness, and we're seeing much more of it. It seems to have migrated from the southern states, southern New England states, to up into Vermont, from the southern part now to the north. And we're just trying to get the word about prevention out. It's been a campaign of the health department to raise awareness amongst families and amongst people in our county and across the state to prevent tick bites, prevent getting Lyme disease. Because what we find is that that's the better method than trying to treat it and trying to identify and treat it,
Right.
which there have been difficulties in that.
So what are the strategies for preventing?
Well, prevention is, it started out historically as just believing that black-legged ticks exist in Vermont and Lyme disease does exist in Vermont, and that was sort of the first step. And so the health department did some studies around dogs and doing blood tests on dogs and collecting ticks from deer at checkpoint stations during hunting season, and to identify them, to show that they do exist in Vermont, and to test them to show that that many of them have carried the Lyme disease bacteria.
So I remember a campaign you did a couple of years ago about asking people whether they knew it was here, believed it was here, and the level of awareness seemed pretty low. Has it changed since
I think
then?
the level of awareness has changed a lot. I think that physicians and medical providers and the public are much more aware of ticks and Lyme disease, and I think that has accounted for a lot of the prevention that has gone on, and also for the identification of all these cases too. I think many of them maybe were missed before because people weren't considering it as a possible diagnosis for their illness.
So what would parents be looking for in terms of whether their child had a tick?
Well,
I mean,
it's the best thing to think about for parents with small children is to sort of assess the risk and then to act accordingly. So ticks like a pretty specific environment. They like to be in a moist environment, not so much in a hot environment, but a moist environment. They love wooded areas, they love tall grass, they love to be in shrubs, they love to be in leaf litter where it might be moist underneath, and they definitely thrive on that. Open areas where there's a lot of sunlight, they don't particularly like, and they can die pretty easily in those kind of conditions.
So a sandy beach is kind of a safe
Sandy
place
beach
for
or
a
an
tick to
open
play?
open field that's mowed, or your lawn that's mowed. It would be more if you're hiking or if you're walking through a field of tall grass, or in a shrubby area, or out in the garden, or where there's a lot of leaf litter. Anywhere where there's those kinds of conditions, and also where there's a lot of deer or where there's a lot of rodent activity. The bacteria is carried around in white-footed mice, and so the more mice there
So
are.
it's not just deer.
No, and it's definitely small mammals
Yeah.
that carry the Lyme disease bacteria, and they are.
People's cats and dogs?
Dogs can definitely get ill from Lyme disease. Yeah, yeah. Cats don't get ill from Lyme disease, so that's not really a concern. But certainly for dogs, yes.
So what about, sometimes you read that you should be putting insect repellent on your children if you're going to be hiking or in the woods. Is there a safe, what do you all recommend? Is there a safe insect repellent for kids?
Yeah, there's definitely options for insect repellents, and we definitely recommend using a repellent. It's basically repel, inspect, and remove. And that information is in this Be Tick Smart pamphlet, and amongst a lot of other things at the health department, that is really great for families. It kind of puts everything into perspective, and it shows exactly what to do in terms of prevention, and talks about insect repellents.
Jeff, where can they pick this up? Do they need to go
We
to
have,
the website?
yeah,
What-
no, we have these at the health department office here in Middlebury. They're also available.
Can you tell people where that is?
Yeah, 156 South Village Green, here in Middlebury, just off Court Street, and we have a supply there. It's also online at healthvermont.gov. Right on the home page, right at the top, it says ticks, so you can just click on ticks, and it'll get you to a lot of the information, much more than this as well. And as far as insect repellents go, there's insect repellents that contain DEET, and DEET has been used in insect repellents for 40 to 50 years anyways, and has been certified by the EPA for effectiveness and safety. It can be used for children greater than 2 months old. There's also other options for people that don't want to use DEET. There's picaridin, which is another EPA registered certified repellent. There's a natural extract, oil of lemon eucalyptus, that has been proven
nice.
to, proven to repel ticks and mosquitoes. Although that can't be used for children unless they're 3 years and older. And so we recommend that to use an insect repellent that's been certified by the EPA, and it should be used how it's written on the label, in terms of ages and applications, etc.
So let's say you take these precautions. You're not tromping through wet, moldy leaves in the woods, and put on insect repellent, but you come home and you examine your child and you do find
Find a tick
on them.
Yeah.
First, what would you see if there were a tick on them, and then what would you do?
Well, ticks have several life stages. The female lays eggs in the spring, and then that's sort of the end of the life cycle for the female. So once the eggs are hatched, the female dies, and then the eggs hatch into a larva stage. And what's important to know is that the larva stage are not infected with Lyme disease.
They're not.
So what they're doing is they're looking for a blood meal, and once they have a blood meal, then they will they'll molt into a nymphal stage, and they get their blood meal from primarily mice, white-footed mice or chipmunks or some birds that all can carry the Lyme disease bacteria, and that's when they get infected. So they're not born infected. So they become infected by the host or the carrier of the bacteria, which are mice.
And they may not even all be infected. There may be
Correct.
ticks
So,
or nymphs or whatever who are not infected.
Correct. So not all ticks are infected. They become infected by taking a blood meal from an infected rodent or bird. And so at the nymphal stage, they're very, very small. They may or may not be infected with the Lyme disease bacteria. It may look like a little freckle or a flake of dirt. And so you want to, when I said earlier that you want to assess your risk and act accordingly, if you're taking your children out into the woods for a hike or to have fun out in the field, or if they kicked a ball into the high bushes and they go to retrieve it, there may be ticks there. And so it's really important to check kids, check yourself, and not to panic if you find a tick on you. In fact, the best thing to do is not to panic, and to get to a place where you can really sit down and deal with it. And you want to remove it, obviously, promptly, but you don't want to get yourself into a panic, and you certainly don't want to get the tick into a panic, because the tick may, in that stage of stress, may inadvertently transmit the Lyme disease bacteria. So you want to stay calm. And then I brought some tick removers. These are just fine-tipped tweezers that you can use. This is a tick removal device. It kind of has two prongs on the end, where you can get underneath the tick and pull it out. This is a tick twister, same idea with the prongs, where you can get under the tick and pull it out.
Where do you get things like this?
You can get these at your veterinary's office. A lot of the farm stores may have them, the drugstore, online. They're very inexpensive. When you remove a tick, you want to stay calm, but you want to grasp the tick as close to the skin as possible. They are only attached with their mouthpiece. So that's what you want to get a hold of, is the mouthpiece, if you can. They may be clutching on with their legs, but they're not attached. They're only attached with their mouthpiece. So you want to just get as close as you can to the skin, grabbing the mouthpiece, and then you want to pull firmly, but you don't want to yank it out because you don't want to break the tick, but you want to just be patient and give the tick time to release. And then they usually pull out.
So if you put some
intact.
Pressure on it, it's likely to release, and you can
Yeah,
pull
it might
out.
take a moment or two, but be patient, and the tick will release.
So what about, they used to say, or I used to hear, that if you put a hot match at the back of the tick, it would back off. Is that true?
Yeah, that's not really
true.
recommended.
No.
Yeah, or nail polish,
Yeah.
or petroleum jelly. Those are methods that really haven't proven to be effective, and they can be dangerous.
So the tweezers or the removal
Yeah, the tweezers
things
or
are
the
way to
removal
go.
devices are what's recommended. And sometimes the mouth part will pull off when you want to avoid that, but if that happens, you don't have to try to dig the mouth part out. You can just leave it. Once the body is removed, then there isn't any risk of Lyme disease being transmitted at that point. And that the mouth part will work itself out on its own.
Do you need to save the tick and take it to the health department, or can you just flush it down the toilet, or what do you recommend?
You can certainly dispose of the tick. If you can save it, so if you do need to go get medical attention, that you can show it to the physician. There is places that will identify ticks, but as far as testing ticks for Lyme disease, the health department doesn't recommend that. And people are always like, well, why? Why not?
Yeah.
And well, there's a few reasons why. Ticks need to be attached for a long time, 36 hours or more, for the Lyme bacteria to transmit from the tick to the person. So even if you had an attached tick, it may not have been on long enough for the bacteria to transmit into the body. So if you get it tested and it comes up, well, there was Lyme disease in that tick, it may not have transmitted to you, for sure. Okay. Yeah.
Just on the off chance that you miss it, I mean, it sounds like with precautions and also then checking after you've been in a high-risk situation, you're going to catch pretty much anything in time. If you don't, how would you know that you had or your child had Lyme disease, and what would the treatment be?
Well, if you find a tick that on your child that is engorged, and that's when they have taken the blood meal and the tick expands, then you would know that the tick has probably been on there long enough for them to feed. And the other thing that you want to look for is symptoms. There's the bullseye rash. It's called erythema migrans, and so if you spot that, then you certainly want to seek medical attention. That would be confirmatory for Lyme disease, and a physician would treat that person right away. There's also other symptoms to look for if you were bitten by a tick. It usually starts out with flu-like symptoms, headache, fever, muscle and joint pain. You feel like you have the flu in the middle of the summer. They used to call it the summer flu. If you get more skin rashes, if left untreated, what the bacteria does is that it's a corkscrew-shaped bacteria. It's called a spirochete, and it has the ability to move. So if you can imagine a corkscrew shape being able to move through your body, so what's happening when that rash appears, it grows over the course of several days, and that's the spirochetes, the bacteria kind of moving along, migrating from one place to another. And the danger is that if it's not identified soon enough, then those spirochetes may migrate to other areas of the body, like your joints or your heart or your nervous system or other places on your skin, and it may cause more severe symptoms. You may get facial palsy or heart arrhythmias, severe arthritis, but most of the time it's very treatable with antibiotics, and most people find a cure with that. But the longer that it goes without being identified, the more likely that you're going to have the more severe symptoms.
Yeah. This has been a great education. Thank you. I mean, it's
sure. Yeah.
I hope I'm getting the takeaway right, which is Lyme disease is here and the ticks are here.
Yes.
It can be potentially very dangerous, but really we can take good precautions and prevent it, and if we check ourselves each time that we're in a sort of risky situation, chances are really pretty good that we're going to catch it and be okay.
Yeah, I mean, and there's other things that you can do too. If you know that you're going into a tick habitat, that you can cover your skin with long sleeves and long pants. You can tuck your pants into your socks to kind of create a barrier, so that if you do brush up against a tick, you'll be able to spot it right away. Of course, using the insect repellents, tying back hair too for longer hair. What ticks do is they don't fly. They're really slow moving. They aren't really seeking out a victim, so to speak.
They're not waiting to jump on you from the trees.
But they're questing. It's called questing, and so they'll climb up on the top of a blade of grass, and they may hold out their front legs, which have barbs, or for lack of a better word, places that if you brush by, that they can easily attach to you. And then they may crawl and find a place to feed on your body.
But it also sounds like a lot of the places that we're playing with our kids in the summer anyway we're not that likely to encounter ticks, as long as the kids aren't running off into the bushes, but they're on a lawn or
lawns that are that are mowed.
Yeah.
The more sunlight that you can bring into an area. For homeowners and for recreation areas, having the swing set out more in the sun and not on the edge of the woods, so to speak, would be more of an appropriate place. The transition line from lawn to the woods is a higher risk area where the grass may be a little taller, certainly in the woods where it's brushy and there's a lot of undergrowth. So when you're hiking, it doesn't mean you can't hike or go in the woods. It just means that stay to the center of the trail and not wander off into where it's not the trail, and setting up your recreation area through landscape techniques to make it safer for your kids and for children.
Great. Oh, Jeff, I'm feeling terrible because now we're almost out of time, and I wanted to hear about your whole life history.
Okay.
I'm hoping that you'll come back sometime, but could you just give us a quick, how did you get into this business? How did you become a public health nurse and get interested in taking care of kids and families like this?
I guess it's in my blood. I've always been, in one or more human services fields. I love working with people, and I've worked with all ages, from infants to geriatrics, and I worked in special education with children and adults for many years, and became a foster parent and an adoptive parent, but I always had an interest in the medical field, and so becoming a registered nurse was a natural progression in my field. And certainly working at the health department was like working in community mental health, only only that I'm working more in a medical situation rather than a mental health situation.
Yeah. You've been there for a long time.
Yeah, 14 years.
14 years.
Yeah. And
so
of course we have the
moved.
WIC program, and so
Right.
there's lots of children and babies and pregnant women coming in, and it's just been a real pleasure. And I just wanted to be part of the community. I love this community. I love Addison County, and my dream was always to be able to help the community, and so any way that I can help prevent illness, not just Lyme disease, but any illness, I'm all for that.
Well, you've clearly been doing that over the years. I've just so much admired your work. I'm wondering if you have any special new dreams for the community in terms of kids' health or the health of families with kids.
Well, yeah. I mean, I just love this community, and it has come together over the years so nicely, and everybody works well together. Everybody seems to know each other that are working with families and kids. And I was volunteering over at the summer lunch program, and it was just such a wonderful experience to see all the kids coming up for lunch, and they were all in their camps and their activities, and running around and eating good food. And I think that the food movement here in Addison County and across the state is just one of the most important things, feeding kids good food and combating obesity and getting kids to exercise and ourselves too, right?
It's been really wonderful. Well, thank you again for being on the show, and thank you all for watching today. We hope that if you would like more information about either ticks or the work of the health department, you'll look at the information at the end of the show. There's a website that Jeff has provided for us. And if you have information that you would like to get out to the public, it's an incredible gift to be able to work with Middlebury Community Access Television. The people here at the station are just fantastic. So give them a call, let them know what you'd like to talk about. If it's a kids and health related issue, please let us know for this new show if there's somebody that you'd like to hear from, or if there's a topic that you'd like to have covered. We'd be thrilled to have you let us know. Anyway, thanks again for watching, and thank you, Jeff, for being here.
Thanks for having me.